Thanks for choosing The Full View tonight. In recent weeks, we've seen a flare-up in protests outside healthcare centres in the country by different groups preventing foreign nationals from accessing public healthcare. Some of those protests were led by Operation Dudula, who say that the country's healthcare system is further strained by having to care for foreign nationals who seek medical attention in this country. Let's get you an update on this. You now bring in SABC News anchor Mbali Thethani. And Mbali, you're out this evening getting the views of different people on the issue of medical treatment, or the push at least for it to be denied to foreign nationals in the country. What's the sense that you're getting?
That's right, Timbegile. Of course, you would have seen in recent days that we've seen a number of South Africans and organised South Africans going to various healthcare centres, and namely, you'd remember the likes of the Hillbrow Clinic. There's also been issues at the Rosettenville Clinic, as well as the Diepkloof Clinic in Soweto, where Operation Dudula and the likes have been, blocking and chasing foreign nationals away from accessing healthcare facilities. And also, you would have seen, even on social media, where we've seen a lot of reaction from South Africans, where some are condemning what is taking place, and others are also at the same time, condoning, what is taking place by some groups of people in South Africa, saying that the healthcare sector in South Africa is strained, and free basic healthcare should only be granted to South Africans. And to continue now to get views, when it comes to this issue, we are now joined by Hosi. He's an international relations analyst. Hosi, we've seen this issue taking place in the country when it comes to the issues around foreign nationals accessing free basic healthcare services in the country, and the likes of Operation Dudula also, going out of their way to conduct marches and protests throughout various parts of Gauteng, condemning this. When it comes to a problem of this nature, do you think that South Africa is seeing a problem when it comes to foreign nationals being chased away from healthcare services?
Yeah. Well, I think the first thing is that in South Africa, health is a constitutional issue, right? And so it is a very big problem for movements such as Operation Dudula to go to hospitals and demand that they do not deserve treatment or healthcare. And it is another issue for them to also then go to the hospitals and put pressure there, right? Where the pressure should be put is on the state. We need to at least speak to the state as citizens of this country to ensure that they themselves are taking the necessary steps to alleviate some of the pressure that we are seeing.
One would also ask, like a country like ours that continues to preach Ubuntu, and looking at what the Constitution says, that the healthcare is an access for all. It's a human right to all those who are living in the country. Where do many draw the line when it comes to Ubuntu and looking at the healthcare sector in this country, allowing foreign nationals and illegal migrants to continue to access healthcare?
Well, certainly, if you look at how we conduct ourselves in Africa as South African in the international system, right, you will see that the reason why we preach Ubuntu is because we want to be the example, right? We want other Africans to follow our example. And if you look at, for instance, the SADC Convention, which discusses the approach of African countries within the SADC region towards health, you'll see that it states there that health should be a constitutional issue. Health should be an issue, and that all citizens and foreigners should have the same amount of access to healthcare. Right? In South Africa, for instance, we are also party to the African Union Charter, the African Charter on Health. Right? And what we then see is we follow what it says by giving healthcare to all African citizens, while some African countries choose not to. Right? And South Africa, where we want to be the example, then we see that what is happening now is that citizens are not happy because it makes us very, very lenient, right, with regards to who we allow in our country and what services they can access, while other countries then also do not give us the same privileges, right? So that is a very, very big issue that we perhaps need to expand on.
And when you say South Africans are also not afforded the same privileges on the African continent, one would then also ask, how does a matter like this be resolved to ensure that you don't get or we don't find ourselves in a situation where someone is sick and is ill and is needing a healthcare in the country, and at the same time, where do we begin to even look into the issues that we are facing as a country? And, how can a matter like this be resolved? Is this a conversation that needs to be had on SADC level or the African Union level that looks into the issues that some South Africans are actually raising?
Certainly, right. The first thing is that it is common sense that South Africa should be having this kind of conversation on the international level, but they're not going to, right? And why is that? Because our foreign policy is one that is enshrined in human rights, and we want to be seen as the best example in maintaining human rights, and health is central to that, right? But as citizens, as young people in this country, what we should then ask, or what we should then perhaps look to, is putting pressure on the state to ask certain questions. If you go to a country, if you need a visa to go to Turkey, if you need a visa to go to European countries, the first thing that you need is health insurance before you even get your visa, right? The question that we should then have is South Africa willing to do that as well? And what are the costs? What agencies can be created, right? What is stopping South Africa from going to other countries and saying, hey, look, our health system is burdened, right? What can you do? We are taking care of your citizens. Your citizens are getting healthcare because you believe that it is a human rights issue, but where can we meet, right? I think those are most of the things that we need to look at. We also need to consider having a more capable healthcare, but that comes with having conversations on an international level.
All right, thank you so much, Jose. I'm also now going to bring in Dimakatso. Dimakatso, maybe you are from Project Youth South Africa, talking about this issue where really you can't prevent someone who's ill from getting healthcare, and also looking at the issues around the constitution of South Africa when it comes to basic healthcare services to all. What is your take when it comes to looking at what is taking place at healthcare facilities and foreign nationals or illegal foreign nationals being chased away by certain groupings?
I mean, I think first we need to categorize what the problem is. This is a multifaceted problem that needs to be addressed in a multifaceted nature. First, we have a governance issue in South Africa that needs to be addressed. We have inadequate healthcare infrastructure. That's the first problem. The second problem is that we have porous borders, and we can't manage that. We're going to keep on saying that the healthcare system is overburdened, but overburdened by who? Sorry. So we need to adequately understand to what degree the problem is manifesting and how to solve it. But we can't do it any other way if we don't adequately diagnose where the problem is, and the problem is with the governance of South Africa. Firstly, why don't we have immigration officers in healthcare systems to say that if you're an illegal persons within South Africa, you will receive healthcare, and then you'll be deported to the relevant place in which you're supposed to be. Because we also burdening our counterterrorism facilities within South Africa. It's not only healthcare. We see heinous crimes in South Africa. I mean, just about a year or so ago, we saw a story unveiling of trucks to Mozambique that have cars in them.
Yeah.
So what do we say about that?
Yeah. And what can then the country do? I mean, I say this in light of what is due to take place in August, and that is then the national dialogue. Is there a need for us as a country to sit down to discuss some of these issues a bit more further? Or do we know really what the problems are already? And, there can be mechanisms now to try and fix these issues.
I mean, with the national dialogue, I think it's categorically wrong to say that we need a national dialogue to solve issues that have been in society for over years. We're not talking about anything new. No new conversations are going to be brought to the table. We already know what we're going to say on existing issues. The national dialogue should be focusing on how do we then build the future of South Africa. Problems are understood. We had the 2024 national elections. We spoke about these issues in details. Citizens of South Africa engaged politicians who were looking for votes. Why can't they deliver on the promises that South Africans have been chanting for over years to say, no, we have an inadequate healthcare system that needs to be addressed? I mean, in the Limpopo province, where we had the premier of Limpopo, who is Popiramato, she knows the issues there. Why isn't she saying anything about this? So we don't need a national dialogue to address these issues. We already know them.
All right, Dimakatso, thank you so much for your time. That is Dimakatso there, Thembekile, just giving us his insights in terms of the issues facing healthcare services in the country, but particularly to the protests we have seen being conducted by certain groupings like the likes of Operation Dudula. And of course, I just want to point out that we did indeed try and get comment from government when it comes to this issue, but the healthcare department in Gauteng referred us then to the national healthcare in the country, but then when it comes to national health, we were then referred to the government of South Africa. But then they are also then saying that this is an issue that they are looking into. There is a statement that they have released, but we will still await and try and get a response from government in terms of what is being conducted about this issue. You would have heard there Dimakatso saying that this is a government issue. This is also an issue around immigration, even calling for the likes of immigration officers to be, to actually take place at some of our healthcare centres. But of course, we'll continue to pose these questions to the relevant people in government to give us a response in that regard.
Mbali Thethani, SABC News anchor, out on the streets of Johannesburg this evening, talking about the battle, if you will, for access to limited healthcare resources between parts of the local South African population and foreign nationals.